Hey, my name's Shannon Wolverton. I am today doing my presentation on the opioid epidemic in the nation. Today I am presenting to Marion Robinson, LPN, Candy Thrash, RN, Dawn Cooksey, LPN, Lisa Sorey, Office Coordinator, Linda Murray, RN, Bridget Ellis, RN, and my videographer today is Haley Boykin, RN. Okay? So today, what I will be going over is the information regarding the national opioid crisis. We're going to, hopefully by the end of this presentation, that you'll all know about the statistics of the national opioid crisis, what it is, understand the impact that the national opioid crisis has on the healthcare industry, including finances, resources, and health. Also, we hope that you know the signs and symptoms of opioid abuse and overdose, identify ways that this organization is combating the threat to the health of our patients, and identify ways that we can all make a difference in this crisis. The national opioid crisis is the misuse and addiction to opioids. It's the leading cause of injury-related deaths in the United States, and that's something that I didn't know. I actually thought that it was from motor vehicle accidents, but this far exceeds it. Adults between the ages of 25 and 54 years of age have the highest rates of overdose deaths. In the late 1990s, the pharmaceutical companies pushed for the healthcare providers to prescribe opioids, and told them that at that time that they did not cause you to become dependent upon them. So with them being wrong about that, by the year of 2018, the yearly average rate of opioid deaths was over 49,000, close to 50,000 deaths. This is a statistical chart that shows the national overdose deaths, and you can see how it increased over time. The most common drugs used as opioids for pain relief that are prescribed are methadone, oxycodone, and hydrocodone. And the most common drugs involved in illicit opioid deaths and overdoses are heroin and illegally manufactured fentanyl. The statistics, there's 1 in 4 patients that struggle with opioid addiction. When they're treated through the long-term opioid therapy and primary care setting, 66% of all drug overdose deaths include the opioids. Approximately 115 people die daily through the nation from an opioid overdose. Sales to healthcare facilities quadrupled over the past 20 years. And over the past 20 years as well, the deaths have also quadrupled. The Center for Disease Control and Prevention estimates that the total economic burden of the prescription opioid misuse is near 79 billion, excuse me. There's also a direct correlation between the increase in the number of opioid prescriptions and deaths. Approximately 30% of patients who prescribe opioids for chronic pain misuse them. As many as 12% who use them have a disorder. 6% transition to heroin, and then 80% of people who used heroin first can say that they first started out on prescription drugs. The U.S. Department of Health and Human Resources, what they're doing to combat this, their 5 priorities are: improve the access to treatment and recovery services, promoting use of overdose and reversing the medications, conducting better health surveillance to better understand the scope of the crisis, provide support and research on pain addiction, and identify better ways to manage pain. The opioid crisis impact on healthcare. This was a little surprising to me. It's very dramatic. I didn't ever take into thought and consideration of what actually it can do. It can take away the time that the responders are going to heart attack victims, motor vehicle accident victims, and things like that. the increase of the 911 calls, the time that they're spending, the government money that's being spent on getting them to and from, and all that's taken away, the medical resources, the doctors and the nurses they're tying up, and the time to take away from those other patients are going toward these that are actually choosing to take on this the opioid addiction. Healthcare professionals demonstrate significantly higher levels of opioid abuse. And here are the signs and symptoms of the use of opioids. Mixing with different groups. If you notice other people like becoming friends with a different group of people, they're wanting to get away from those that know them well. Losing interest in activities, not bathing, changing their clothes, or brushing their teeth, being very tired and sad, eating more or less than usual, being overly energetic and talking fast, saying things that doesn't make sense at all, being nervous or cranky, quickly changing moods, sleeping at odd hours, missing important appointments, getting into trouble with the law, attending work or school erratically scheduled, and experiencing financial hardships. Now we're going to move on to the signs and symptoms of opioid overdose. The person's face is extremely pale. They feel clammy to touch, kind of cool and clammy to touch. Their body may go limp. Their fingernails or lips have a purple or blue color. They start vomiting or making gurgling noises. They cannot be awakened, or they're unable to speak. Their breathing or their heart rate slows or stops. Here we're moving into the signs and symptoms of opioid abuse within healthcare professionals, all of us. They may have reoccurring absences or tardiness, problems with functioning, extremely difficult decision making. Their productivity and efficiency may change. They may disappear and we may not know where they're at for hours during the day, not returning our calls, appearing impaired or disheveled, slurring of the speech, and smelling like alcohol. The ways that we as an organization can combat this epidemic, we know that opioid abuse is a treatable medical condition. We acknowledge successes in recovery and encourage the patients to maintain their program. We advocate for community programs and assist in substance abuse disorder. Like the methadone clinics we have here in close by in Morton, and then also Newton, that they're trying to, they're starting that new, so we can help with getting our patients into those if needed. We reach out to our patients and families and let them know the earlier the treatment, the better the outcome can be. We educate them regarding the prescription drug abuse, and it's up to all of us to provide a strong sense of care and compassion, promoting these things to our patients so that they can attain and achieve remission if needed. So we can also screen for high-risk conditions, develop pain management clinical pathway protocols, which we have in our home care, home-based system. We can discuss other treatment options so that that doesn't involve opioids. And I have that, the pamphlet that I have passed out today. I have this so that you can see some of the alternative pain control measures here that can be used. All of this can be used within our teaching for our patients. It has the safe opioid use, the alternative measures, common drugs that are used. We have another resource that they can log into that can help them find more on the pain medication and avoiding the misuse of it, and then safe ways that they can take the medication, take their opioids when it is needed for cancer, pain, and other treatments that are needed. We can also evaluate reasons for current use of prescribed narcotics, train our nurses and therapists on opioid use and addiction, and I would like to present this to them as well, and educate our families on opioid use and addiction, and offer referrals to specialized clinics like those methadone treatment centers. I hope this has all been helpful to each of you and that we can use it in our everyday practice. Thank you all for being here for me today.